Hello friends, welcome back to my channel. So today we are going to talk very high yield topic from forensic medicine. It is skull fracture, which belongs from head injury. So in skull fracture, the most common bone fracture is temporal bone. There are types of fracture. So first we are going to talk about the fissured fracture. It is linear fracture. It is most common over all skull fractures and it is seen in autopsy. In this image you can see this is the linear which I am drawing here. So this is the linear fracture. It is very easy to identify. Another fracture is diastatic fracture. It is associated with sutural separations. It is mostly seen in young adults and most common is sagittal suture. You can see in this image here this is diastatic fracture. Third one is depressed fracture. It is mostly caused by heavy weapon and the pattern of fracture tells about the weapon, which type of weapon is used. And it is also known as signature fracture. See the image. Here is like kind of depressed pattern. So we can call as a depressed fracture. Fourth one is pond or intended fracture. It is commonly seen in infants. There is dent in skull bone. We can also call as ping pong ball fracture and it is caused by obstetrics forceps bled. So this fracture is mostly seen during the delivery of patient. Fifth one is gutter fracture. It is due to glancing bullet. As oblique bullet comes tangentially. You can get idea from this image. As the bullet is coming from tangentially, it is touching the skull bone and it is passing. So it is known as gutter fracture. Sixth is comminuted fracture. It is caused by a heavy blunt blow. There are multiple fragments seen in this fracture. We can also known as spider web fracture and the fragments are displaced. See this image here. The pattern is like spider web here. And it is due to the very heavy blow. These topics are very high yield. These images you have to remember. So in your upcoming exams, it can be asked in MCQs. Also learn the patterns, which is linear one. You should not get confused in diastatic fracture and linear fracture. Just observe, linear fracture is the single line over here and it is not a single line. So don't get confused. In depressed fracture, there is depression over skull. In gutter fracture, it is very simple to identify as the bullet is passing tangentially and it is touching the bone of skull and it is passing. And comminuted fracture is kind of spider web like fracture, or you will get many fragments in this fracture, so you can identify very easily. So that's it for today. Thank you so much.